Good morning, folkers. Good afternoon, good evening, wherever you're at in the world. This is Snapzilla Gorilla with the Definition of Anarchy channel. And today is Monday, May 18th, 2020. And it's raining out here in Southern California. Looks like they're allowing the rain. I don't know, to encourage people to stay in the house. I don't know, man. Listen, I'm gonna stay on the subject at hand. Now, this story I'm gonna touch on is about 3 weeks old, and it's very alarming. It's very disturbing, and I, for the life of me, cannot understand why more alternative news sources have not touched on this. What you're about to see and hear should give you a little bit of apprehension about whether or not you should take the COVID-19 test. I'm going to play the video and I'm going to speak on it, and then I'm going to show you the article that I first discovered in regards to this. 3 weeks old. 3 weeks ago, this came out, and our officials, our representatives, the president is still pushing testing. They want, 200 million tests a day for every American? Nah, miss me with that. Let's see what's going on here.
By the Washington Post, there were issues with cross-contamination. So we're going to speak to the reporter who looked into this. His name is David Willman. He took a closer look at this. David, you're an investigative reporter for the Washington Post. This is particularly disturbing because I think when many people think about the CDC, it's kind of like the gold standard when it comes to research and advice on diseases. So first off, just tell us exactly what the cross-contamination was, what the misstep was, and the effect.
Yes, good morning. Good to be with you. The getting reliable tests out to the hospitals, the clinicians, to the public health labs around this country was delayed. And the big unanswered question was, what was the cause of the original delay? And what we've reported is that there was a violation of sound manufacturing practices at the CDC in Atlanta that resulted in contamination of the COVID-19 test kits. And those kits then went out to public health laboratories around the country, and false positive results immediately showed up in those laboratories. Those results were reported back to the CDC, and the CDC took quite a long time to get on top of what was causing the problem and to remove the component of the test kit in which the false positive results had repeatedly emerged.
So, can you walk us through the timeline of testing in the United States?
Sure, I'll give it a whack. Key first date, I think, is January 12th of this year. That's when the Chinese medical authorities made public the genetic sequence for this virus. And once that genetic sequence was made public, it's sort of analogous to a bunch of track athletes down in their blocks ready to fire. And so the scientists at the CDC, at other labs around the world, many of them with sponsorship from the World Health Organization, set about using that sequence to develop a DNA test that could reliably assess whether a person was infected or not infected with the virus. That's the first stage. From there, the test kits started rolling out around the world. The first testing was done within days of January 12th. And the CDC, in fact, accurately confirmed the diagnosis of the first United States patient on the weekend of roughly January 18th. And thereafter, there was no problem with the reliability of that test. It was thereafter, as we've reported in the Washington Post, that a second batch of kits was sent actually to the first wave of public health laboratories around the U.S. And it's within that batch of kits that the contamination had occurred at the CDC.
So your reporting left me with so many questions. I'm sure for you too. Two of them is, why did the CDC violate their own guidelines in terms of how you manufacture these drugs? This test. But also, the biggie really is, once they realized that there was a problem with the test, it took them, according to your reporting, a whole month before they rectified it. Why did it take so long?
Those are excellent questions, Anne-Marie, and we don't yet have, I think, complete answers, anything close to complete answers to those things. Obviously, I think we have to assume that the CDC is not deliberately making mistakes or deliberately introducing contamination. These are highly sensitive processes in which, if everything isn't done exactly according to protocol, you can have a mistake. But as we all know, this saga of unreliable tests went on for weeks and weeks, and sort of the soundbite from the CDC in real time was, well, some of the state labs are having difficulties, they're having quote unquote inconclusive results. We're doing everything we can to help them straighten out the problems. The fact that it went on for weeks and weeks while this virus took a hold in this country those are questions that are going to be pursued, I'm sure, for many months.
Now, we're talking weeks and weeks of contaminated tests going out to the people, okay? And you experience symptoms, you have this fear in you from what the media is putting out about the COVID-19. You believe in the COVID-19, you believe that it's such a devastating disease. So you go get tested. Odds are you've been tested with these test kits that have been contaminated. They tell you have COVID-19 because of the false positives and the inconclusive results. Now, my question is does it stay a false positive? If the test is contaminated, does it stay a false positive once they swab you and take it to the lab to get tested? It's going to show a positive because of a certain reason. I'm going to give you that reason in a minute. I'm going to jump to a different page to show you guys, okay, what really happened. And so these tests are being administered to people who likely do not have COVID-19. But after taking this test, they test positive. Now, they say it's a false positive because of the contamination. But now, these people have COVID-19. Now, there's been speculation, and there has been people saying that, they believe, and including myself, that if this COVID-19 thing is what they say it is, then it's likely that the test has been contaminated with COVID-19 and given to people, and now they have COVID-19 because they have been given a test that had COVID-19 on it. They didn't have COVID-19 until they got tested. Now all of a sudden they got COVID-19. That's happened to people third degree, right? 3 degrees. I'm 3 degrees separated from someone who has had COVID-19. They went to get the test. Boom. They didn't have any issues before they went and got the test. They went and got the test because I guess they might have contacted somebody, come into contact with someone who had COVID-19 or something like that. They have no symptoms. They go get tested. Boom. The next day, they start experiencing symptoms. A couple of those cats died, whatever the case may be. Now, you have this story right here that I just found out about yesterday. Like, I had a feeling that these tests would be contaminated, and I know myself, I don't care what kind of symptoms I'm experiencing. I don't want to take this damn test. But now this just drives it home for me. It cinches it. So let's continue on with what he's saying.
David, I hear the president, when he steps up to that podium every day to do those what are sort of becoming political rallies now, talking about the millions and millions and millions of tests that are being done in the United States. But according to the Johns Hopkins Coronavirus Resource Center, there have been 4.1 million tests conducted in the U.S. so far since we began testing. The U.S. is still just testing a fraction of the total population of the 330 million plus Americans. So how clear is it that the delays hindered scalability of testing across the U.S.?
You see what's happening here? They know the test kits have been contaminated. They know that tests have been going out that have been false tests, right? These mock tests that they caught at the airport. In Tanzania, the president received some test kits and decided to run a test to see if they actually were working properly. So he tested it on animals. He tested it on the papaya. The papaya came up positive for COVID-19, right? So now you see the fourth branch of the government, right? The fourth branch, the propaganda branch, the media, are still pushing for testing, even though they know that these tests have been contaminated. Even though they know we can't trust the CDC. We can't trust these individuals. We can't trust these laboratories to do the right thing. But they still are complaining about there only being 4 million tests that have gone out. Listen, we don't test for the flu. We don't test for the cold. We test for the flu if our flu symptoms are bad enough, right? Some people might, to make sure it's actually the flu. But we don't push for testing for these things. We don't push for testing for tuberculosis. We don't push for testing for staphylococcus, which is staph infection. We don't test for any of this. But we have to test hundreds of millions of people for COVID-19 every day. And they want us to take in-home test kits. They want to they want us to give them our blood. Man, look, this is complete nonsense, okay? That they are still pushing this testing, even though they know that the tests have been contaminated. There's been ample proof of that throughout the months since this whole thing started. It's very irresponsible to push that out onto the people. And now we know what type of media we have.
Well, we know that the original delays inhibited the CDC and the public health authorities around the country ability to detect whether the virus was landing here in the United States and to what magnitude it was spreading through human.
Oh, it did more than hinder these organizations. Excuse me. It also possibly, allegedly, poisoned the people that were being tested that may not have had COVID-19 before the testing started. Imagine how it started popping up everywhere. Look how COVID-19 spread. It started in New York and Washington, right? And then all of a sudden it started popping up everywhere, like wildfire, all over the country. I'm just saying. People start becoming fearful of this thing. They start experiencing symptoms, so they'll go get the test in a state where there might not be an issue. Boom. Now they have COVID-19. Now it's being spread to other people. Whatever the case may be. That's if you believe in this thing. So why are we still pushing for testing if we know that the test can be so easily contaminated and that the CDC is very negligible in the care they're taking in creating these tests? And then they want us to take a vaccine by the end of the year. They ain't miss me with that nonsense, man. Miss me with that BS. Miss me with that donkey and that elephant shit. You understand what I'm saying?
And that was huge from an original standpoint. But you're putting your finger on another aspect of the testing deficit, and that is the lack of what is called high throughput testing capability. In other words, the CDC, even if there weren't problems, was not positioned technologically, nor were most of these public health labs, to conduct the volume of
That's enough of that. The tests were contaminated. Oh, well, we need to push for more testing. How about you stop the testing, take a step back, and see what happens? Make sure all the test kits are properly manufactured. Make sure they're not contaminated to the nth degree. Give it a couple weeks. Stop testing people until you come up with a proper test. They don't want to do that. They want to just keep manufacturing tests. They want to take a step to. Let me show y'all. All right. So this is from the New York Times. This discusses in detail the issues that the CDC was having with manufacturing these tests. Sloppy manufacturing practices at the Center of Disease Control and Prevention caused contamination that rendered the nation's first coronavirus test ineffective. Not just ineffective, though, and I'll tell you why. They're not going to say that, though, because they still want you to take the test. They still want the test to go out there. 2 of the 3 CDC laboratories in Atlanta that created the coronavirus test kits violated their own manufacturing standards, resulting in the agency sending tests that did not work to nearly all of 100 state and local public health labs, according to the Food and Drug Administration. It didn't just render them, ineffective. Early on, the FDA, which oversees the laboratory test, sent Dr. Timothy Stenzel, chief of in vitro diagnostics and radiological health, to the CDC labs to assess the problem. Several officials said he found an astonishing lack of expertise in commercial manufacturing and learned that nobody was in charge of the entire process, they said. Problems ranged from researchers entering and exiting coronavirus laboratories without changing their coats to test ingredients being assembled in the same room where researchers were working on positive coronavirus samples. Test ingredients being assembled in the same room where researchers were working on positive coronavirus samples. Cross-contamination. Coronavirus ended up on these swabs. You administer the swabs to individuals who aren't sick or who may be a little sick, maybe with the cold, maybe with the flu, but you're giving them swabs contaminated with coronavirus. Then they actually have the coronavirus, and then what happens? Those practices made the test sent to the health labs unusable because they're contaminated with coronavirus. What? And produced some inconclusive results. It tells you right here, YouTube. This ain't me, YouTube. This is the New York Times and the CDC and the Food and Drug Administration telling you this. Those practices made the test sent to the public health labs unusable because they were contaminated with the coronavirus and produced some inconclusive results. They didn't just produce some inconclusive results. They produced coronavirus patients. That's what common sense is telling me. You contaminate the coronavirus with test kits, right? According to the CDC, according to the World Health Organization, according to all these organizations in the government, the coronavirus can last for 20,000 years. Yeah, all that bullshit. So you have coronavirus on these swabs. They quickly get these tests out to the state labs. Boom, you administer the swabs to people. You put it all up in their sinuses. You swabbing. And you're not just getting the material from their sinuses, you're also leaving material from the swab in their sinuses. In a statement on Saturday, a spokeswoman for the FDA, Stephanie Kokomo, said CDC did not manufacture the test consistent with its own protocol. The FDA confirmed its conclusions last week, late this week, after several media outlets requested public disclosure of its inquiry, which assuredly is part of the larger federal investigation into the CDC lab irregularities by the Department of Health and Human Services. To this day, the CDC's singular failure symbolizes how unprepared the federal government was in the early days to combat fast-spreading outbreak of a new virus, and it also highlights the glaring inability at the onset of establish systematic test policy that would have revealed the still unknown rates of infection in many regions of the country. The blunders are posing new problems as some states with few cases agitate to reopen, and others remain in virtual lockdown with cases and deaths still climbing. All because if you were to follow the line of logic, right? If you were to get a flow chart, create a flow chart, and you start from the beginning in January, and you move along to April, and you discover that these tests are contaminated with COVID-19, and they're administering these tests to people. The fact is that they're leaving out the fact that when you're swabbing people with these contaminated test kits, you're now leaving the material on that swab in that individual. And of course you're going to get inconclusive results because their saliva and mucus, which is mixed with the COVID-19 that's already on the swab, dilutes it. It makes it look funky. That's what common sense tells me. But I don't need medical expertise. I just need to comprehend and read, right? That tells me that I don't want to get this test. Under any circumstances will I ever get this test. Now, if I had to, not the swab. They have one where you can spit into the thing. They say it's not as effective, but fuck that. If you feel the need that you want to get the test, if that's really in your heart that you want to do that, I suggest you find out how you can do the spit test. Spit into something, and that's how you do it. Or if you feel like you had it and you recovered, if you really want to do it, I don't suggest anyone get these tests. I don't suggest anyone get the antibody test or the initial test. But at least with the blood test, you can go get your own self a needle, go to CVS, get your own needle, and say, look, I don't want you to use those needles. I want you to use mine. And they'll put the little vial into the thing, and then boom, boom, boom. Now you know that you have brought a sterile needle that you know is not contaminated. If you really have to do it. I don't suggest it. Anyway, so this is a problem. And I cannot believe that this story wasn't touched like that. I mean, the mainstream media touched it. As you can see, New York Times touched it. But this is confirmation that the CDC may have caused the spread of COVID-19 as to the level that it's at right now. If you follow the flow chart, the line of logic, in my mind, this is what I'm seeing. So, but then you can see here that this highlights the federal government. See, they'll always throw in the left-right paradigm, the Trump administration failed, and this, that, and the third. No, y'all failed too for driving fear into people's hearts, and essentially having them go get testing when they coughed a little bit, or if they climbed up a flight of stairs and they were out of breath, even though they've been out of breath climbing up a flight of stairs for half their life because they're out of shape. Yeah, you're breathing hard because you climbed up a flight of stairs and you have no endurance, you have no stamina, you have no lung capacity. Go out and exercise, go out and get some sunlight, get that vitamin D, vitamin C, zinc. I'm not saying, look, YouTube is striking people and knocking people's channel down for saying that the vitamin C cures COVID-19. I'm not saying that. What I'm saying is vitamin C boosts your immune system, vitamin D boosts your immune system, zinc boosts your immune system, right? Exercise boosts your immune system, and while you're exercising, it's key to have a recovery drink that has vitamin C, that has zinc in it, that has these things, oregano oil, and all those other type of things, BCAAs. Because when you exercise, your body is opened up, and it allows things to enter that wouldn't otherwise be able to enter. Right? And it gets the blood flowing, and it gets the blood to work, and it gets the blood to places that need to be healed, and all that other stuff. But if you put vitamin C in you, get that vitamin D, get the zinc while you're exercising, after you exercise, all that stuff will reach where it needs to get because you're opened up. So anyway, y'all let me know what y'all think, man. Do y'all think that this possibly this mistake by the CDC, this mistake, right, could have caused the number of infected cases? Do you guys believe that may have happened? Or do you think, oh, well, you know, it might have been contaminated with COVID-19, but that doesn't mean that when they gave the test to people that they gave them COVID-19? Or is it sometimes it may have, sometimes it may not have? What are the odds that so many of these tests were contaminated with COVID-19? What are the odds that none of them gave people COVID-19 as they were swabbed? So anyway, y'all let me know what y'all think. And yeah, hit me up in the comments and share and like and subscribe to this video. This information needs to get out there. I put the link to this article in the description, as well as the link to that video in the description, so that you guys can check it out for yourselves. Check out the whole thing and read the whole article. All right, peace out, y'all.